Hi, my name is Vanessa Cross. I will be playing the role of the juror for the purposes of this assignment. This video is to discuss the case of Patients versus AU Bright Smiles Dental, where several patients are the plaintiff and AU Bright Smiles Dental is the defendant. First, I would like to briefly summarize the case before presenting my decision for ruling in favor of either party. The plaintiffs or the patients filed the case because several patients' files or folders were marked with red stickers with the word AIDS on the outside of their files for other patients or people in the clinical area to see. The defendant is arguing that this is necessary for both patient and employee safety. The plaintiffs argue that this violates their privacy and HIPAA regulations. To this point, I would rule in favor of the plaintiffs. I agree that identifying patients with AIDS is a necessary step for patients, as this medical condition can cause complications in any procedures performed, as well as for employees who need to be certain to take appropriate precautions. Having said that, this condition could be identified in a more private and professional manner, one which does not violate the patient's privacy nor display their medical condition for anyone in the dental clinic to see. One method that could be utilized would be to place the sticker identifying that the patient has AIDS on the inside of the folder rather than on the outside. It would not be visible to others, but when staff members at AU Bright Smiles Dental Clinic look in the file to verify that they are with the correct patient, which could be verifying their full name, their date of birth, address, phone number, social security number, just to name a few examples of the information that they could verify. This identifier would be visible and the staff would be alerted to take appropriate precautions. This is an important step because no PHI or protected health information can be displayed on the outside of the file or folder. Therefore, it's necessary for the staff members to open up the file and identify that they are with the correct patient. I'd like to present a scenario just to support my point as to why this is a violation of the patient's privacy. Say a patient, whose name is Bob, happens to have AIDS and therefore a bright red sticker on his file folder, is at AU Bright Smiles Dental, along with his neighbor Sue, a co-worker named John, and several other patients in the waiting area. An AU Bright Smiles employee enters the waiting room with Bob's folder to call him back. The AIDS sticker is visible to the entire waiting room, and now Bob's neighbor, co-worker, and several others have seen that he has AIDS. And they have got this information without Bob's approval or authorization. Not only is this a violation of privacy and sharing of PHI without authorization, it has the potential to cause complications in Bob's personal, professional, and social life. One of the 4 ethical principles, non-maleficence, states do no harm. This violation of privacy is causing unnecessary harm that could have easily been avoided had they protected the patient's privacy. I'm not arguing the need to identify patients with AIDS because that's a very important step in the medical community to not only protect the patient from complications from procedures and to identify their special medical needs because of the medical condition, or the need to protect the employees who need to take special safety precautions, as well as know that they need to take special medical precautions for these patients, but the need to maintain the patient's privacy and confidentiality by not advertising their condition, whether on purpose or not, for all others at AU Bright Smiles Dental to see, and therefore I would rule in favor of the plaintiff on this case. It's important not to violate HIPAA, it's important not to reveal their PHI without their authorization, even if they did receive approval from the patient to identify their folders with some kind of identification that they do have this medical condition. It's necessary to not put it for other patients and other staff members or members in the clinic to see. It's important to put it in a place where only the staff members that are working with the patient can see this, and that will be done when they are verifying the patient's information when they call them back into a private area. So like I said, I would rule in favor of the plaintiff on this case because their rights were undoubtedly violated, and AU Bright Smiles needs to take action to correct this violation.